We're entering our second winter with COVID. Last year, we were subject to restrictions and people's behaviors were curtailed in terms of what we would ordinarily be doing. Restrictions were lifted in July, and people have more or less gone back to living their lives as normal, as much as possible. Many people probably don't think about COVID as much as they did a year ago. However, COVID is still with us. It has not gone away. We have seen the rates rise since restrictions were lifted in July, and they have remained relatively high compared to the numbers and the rates that we were seeing before July. In fact, we have been consistently above our previous peak, which we experienced in January of this year. Our most recent figures are 411.8, which again, compared to the previous peak, is about twice that level. In a sense, we've now a new steady state, and our rates have fluctuated between 200 and 400 on average. The key difference is that now the main focus of our new cases is in school-aged children, particularly secondary school-aged children. That is something that we've seen not only in Torbay, but across the whole country, and in particular across the Southwest. One of the key factors has been that with fewer restrictions in terms of how schools are run, students are mixing far more freely than they did before schools closed in summer. And therefore, we know that the infection, if someone becomes infected and they're mixing with people from different households, the chances of spread are increased. One of the things that we're seeing is that the infections in children will often then spread into their households and affect parents and sometimes grandparents. And where those people are not vaccinated, or where they have an underlying health condition or any factors that affect their ability to mount a full immune response to the vaccine, then those people are vulnerable for illness and complications of COVID infection. So it is important that we continue to do our best to decrease those infection rates and to protect the most vulnerable. Of course, one of the most powerful tools that we have is the vaccination program. And that has generally been rolling out well. Uptake has been good. But we want to continue to encourage those people who, for whatever reason, have not yet been fully vaccinated. A number of pop-up clinics are going to be held in Torquay, in Paynton, and in Brixham. And information about those will be on the council's website, and we will be promoting them quite heavily so that anyone who's not had an opportunity can come forward. We want to particularly appeal to pregnant women, for example, because we know that they can suffer consequences of premature delivery, for example, during the later stages of pregnancy. It's important that those who are eligible for booster doses and are invited, that they come forward as well. One of the things that we have learned is that the immunity to COVID does not last, whether it is acquired natural immunity from having the infection before or having the vaccine. The full protection wanes over time. And for the most vulnerable, and particularly those who had their vaccinations at the beginning of the campaign, it's now time for them to have the booster to ensure that they are as protected as they can be as we go into winter. This winter, we expect to be more severe in terms of infections compared to last year. Because there were restrictions, not only did those restrictions on people's interactions with each other, not only those restrictions decreased the transmission of COVID from person to person, but they also decreased all the other winter infections, including flu. Now that restrictions are lifted, we expect to see a reemergence, a resurgence of the flu and all of the other winter type infections. And that is a concern, particularly for our health services, which have been under considerable pressure as they've been trying to respond to backlogs developed over the periods when we were in lockdown, as they attempt to deal with the everyday of doing what they do so well. So we want to do as much as we can, not only to protect ourselves, our families, and our communities, but to ease the pressure on the NHS and on our health and social care services as much as we can. And that's why the appeal for vaccination is so important, not only the COVID vaccination, but also the flu vaccination for those people who are eligible. But in addition to vaccinations, we also need to continue those key measures that can help us to prevent spread from person to person. When the background rate is quite high, those people who are vulnerable because for whatever reason they haven't been fully vaccinated, or because there's an underlying health condition, or there is something that affects their ability to mount a full immune response to the vaccination, those people are more vulnerable to infections and complications because of the higher background rate. So we want to ask people, as we've always done, to be aware of those key measures that we can take to continue to be scrupulous in our hand washing, to continue to use face coverings, particularly when we are in crowded indoor, poorly ventilated areas, when we are mixing with people who are not part of our usual household or social bubbles. Whenever we become symptomatic, and as we go into winter, many people will develop respiratory type symptoms. Not everyone will have the classic new cough, loss of taste and smell, the kind and fever, the kind of classic COVID symptoms. But it's important that if you are feeling unwell, that you test and that you isolate, and particularly if you have a COVID positive test, then it is important that you fulfill that period of isolation so that you then do not transmit it onto others. And that is how we can help to break the chain of onward transmission and decrease the numbers that we have to deal with. We've made a lot of progress. COVID is still a challenge, albeit that with effective public health measures, it is less of a threat to us than it was a year ago. But this is a virus that wants to survive and will adapt to the situation. We're constantly on the lookout for new variants that may emerge. But in addition to looking out and responding to changes in the virus, we also need to continue to do the things that we know are effective in controlling infections. And that is coming back to those basics of hands, face, space, and letting the fresh air in. Particularly over winter, we know that people will not be outdoors as much as they were over summer. And therefore, we're asking people to begin to think about how their activities and behaviors might increase the risk of transmission, and what each of us can do, the simple measures that each of us can take that will protect ourselves, our families, our wider communities. We know that half term is coming up, and we want to repeat a really good practice that we've had over summer, that as people travel into the Bay for that period, we can continue to keep them safe. As our own residents travel out, that they will take those good practices with them that will reduce their risk of passing on infection to others, but more importantly, prevent them from contracting the virus and returning home with it. We've done so much to keep COVID in check, and it's important that we continue to keep those measures in place, that we continue to take sensible and responsible action to protect ourselves and others as much as possible. Thanks.